Good Friday morning, everyone. It is November 4th. Welcome into the Morning Medical Update. It is going to be a great, fun, packed show today. We are live inside the Dolph Simons Family Broadcast Studio. Thank you for joining us via YouTube, Facebook, and on our podcast. It is a day millions of parents have waited for, as just this week, the Pfizer vaccine is now EUA authorized for kids 5 to 11. If you plan to get your kids vaccinated, please make sure you snap a pic and send those in because we would love to share them. But we have got 3 right here live in our studio this morning. They can hardly wait, right? Are you excited? Yeah. I need to see excitement. Yeah. Okay, got a thumbs up and kind of so-so. Okay, so you're going to be able to see these kids live, get their vaccine. You get kind of a behind-the-scenes look of the Morning Medical Update because we've got Adam Meier right here. Joining us, and he is Director of Nursing here at the health system, of course, Dr. Stites, and me. We're going to be taking your questions. They're going to help us kind of navigate what this rollout is going to look like here at the health system as we get another group vaccinated. Of course, we're going to take your questions about kids and the vaccine coming up here in a minute, so make sure you start getting those questions into us. We want to try to get to as many as possible today, so send them in via YouTube, Facebook, Twitter, and right there, we're going to put those links up on your screen. You can email them to the Medical News Network. Okay, so let's get all that out of the way. And now let's get to Medical Director of Infection Prevention and Control, yes. Dr. Dana Hawkinson. Good morning to you.
Yes, I'm here too.
You are here every day.
You, but blah, 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 blah. Sometimes anonymous. So.
Nope, all you're right. Here. Let's do it. How are the numbers looking?
The numbers are looking pretty good. We are kind of holding down now under 15 for the last couple days, or we've had some blips. Or lower blips this last week. We have 14 active infections right now with 4 in the ICU and 1 of those on the ventilator. Only 1 of those people is fully vaccinated. We have 19 additional people in that recovery period. We did have a death as well. And Hays has 11 active infections and 6 in that recovery period also.
Dr. Stites, we've been talking about the numbers, and people ask, what do those numbers really mean? And sometimes those lower numbers don't always mean that COVID is going away or has gone away.
It's not going away. A couple of big things here. So first, if you look at the curves across Kansas and the Kansas City metropolitan area, the numbers of the curves have flattened out. Mm-hmm. They were actually projected to continue to decline. They have not continued to decline. They've flattened out. If you look at Colorado, when they had been declining, they flattened, and it's because they didn't keep going down, and then they went back up again. And I think what happened in Colorado is the removal of masks and people going inside and things getting colder. Now the mask mandate's gone in Kansas City, right, except for children and adults who are teaching schools. So here's my fear. My fear is it's come down. We're at a level state, steady state. So we haven't kept getting better. That's with masks on. Now the masks are going to come off. So I'm a little concerned about that. The good news is the Pfizer antiviral pill knocked it out of the park. They released their data is anywhere near as good as what they said it was going to be. 85% reduction in severe hospitalization and death. That turns it truly into Tamiflu. And we said the Merck pill looked good, but the Pfizer pill, they had a 50% reduction. Pfizer pill, 85% reduction. And if you took it within 3 days of symptoms, you had an 89% reduction. They stopped the trial early because the results were so good and the side effects so few that they wanted to go ahead and get the early use authorization in. They think they'll have doses ready and out before January 1st. Hawkeye, I think this result that's a game changer in terms of the seriousness of COVID-19.
Mm-hmm. Yeah, we know that it is difficult to identify compounds and create drugs for viruses quite a bit more, I think, than bacteria. So this is really good new information. We would still like to see the full data, but their release, and they have some very early studies. But I think it looks good, and we have to wait and see. I'm certainly excited to see how things look different now in the UK now that it's been authorized for the Merck product. The same thing will be said, again, it's still very early stages. So we still have a lot to do before we get to being able to deliver it to the general public. But it looks promising, and it's just one more thing to help prevent hospitalization and death, and that is really what we're looking for. The best method we have continues to be vaccination. We need to utilize those non-pharmaceutical interventions like masking and distancing. But this is one more thing, if you are infected, to help reduce your risk of coming here to the hospital.
And I think it'll be a huge win. The other thing they're doing now is studying people in households with one person having COVID to see if, like Tamiflu, it can reduce the risk of viral transmission, which would be another big win, because that would make it a lot like Tamiflu and how we use it. So that would be another big deal.
Do you think
Tamiflu?
No, this new drug from Pfizer. Yeah,
Yep.
they're studying it in households to see if it
Do you think this
reduces
is going to have people holding off then on getting the vaccine?
Yeah, I hope not, because that would be the wrong choice.
Right.
Just as we encouraged the influenza vaccine. First of all, it won't be available until after, maybe toward the end of the year, this year. It's been purchased by the government. I think it's like $700 per treatment course. So I think the cost initially will not, if I'm understanding it correctly, and Hawkeye, maybe you know, there won't be a cost to patients initially. You have to have a prescription for it. And then they're also doing the same thing that Merck did with poor countries, where they're going to have it made by generic groups around those countries, so that the drugs can be distributed much more cheaply to poor countries. And so I think that's a big win. It should not replace vaccination. A couple of thoughts. A, it's been studied in elderly, those over 60, or those who have other organ diseases. So that's actually good. That's a population we want to protect. But B, we don't know about the emergence of any variant. And so we know that vaccination has done a great job protecting against variants.
I think we have some reporters on the line. Go ahead with your question.
We do. Good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Happy Friday. As Dr. Stites was mentioning, Kansas City, Missouri's removal of the mask mandate for most people, help me wrap my head around this, Dr. Stites. So you guys have said for a long time that a lot of the COVID transmission isn't happening in schools. And now that's the only place where masks are required. What's your take on that?
Yeah, I'm just nervous. I'm more concerned about people going inside in bars, restaurants, and any kind of gatherings and thinking they don't need to wear masks. I mean, mask wearing had already been a bit on the wane, right? Mm-hmm. You can see it when you go into places. So I think that's a concern. We felt like people were safe last year in schools with masks and with distancing. So I think that's why schools are safe, and I think they continue to look good so far. So I'm kind of glad we're keeping in the schools with the masks on, because not that many children have been vaccinated yet. And we'll hopefully start to change that story this morning on this program. But I'm a little nervous about the masks coming off as winter comes in and the holidays. I'm afraid that, like Colorado, there's a lesson waiting for us, and the lesson is that, Hawk, I think we could be in for another surge. Hopefully nothing like we saw in August and September when things were so difficult here.
Yeah. No, I think we were happy and believed the schools were safe because of those things those protections they were taking. So, I'd be concerned once the masks do come off. But I think we do have one better thing now, and that is the ability to get these young children 5 to 11 vaccinated now.
Yeah, I think that's such a big win.
Other questions?
I heard somebody take a deep breath.
Mm-hmm. Are we good? All right,
it
jump
wasn't
back.
me that took the deep breath, but I'll ask the question.
Okay,
go ahead.
Question about why you think we're still classified as an area of of high concern by the CDC, where the transmission rate is still pretty high. We were talking about that this morning on our newscast, where we're still considered to be that, while there's some parts of their map, especially in the South and in Texas, that kind of thing, where they're lowering that. Why are we still considered to be high transmission?
Yeah, I mean, most of that transmission rates are due to per capita, so they look at the amount of people and then the number of cases within that. I'd have to look specifically at that, but again, some of that is also due to the data collection. They may not be fully up to date on data. For instance, we know influenza rates and infections, they lag behind a week as they're doing the data collection, but it's based on per capita, so it's not necessarily just the number of cases, but it also has to do with the total number of people in that region and the number of cases. So you're looking at, depending on if you're looking at 10 cases per 100,000 people versus 200 cases versus 100,000 people. So I think that has a lot to do with it, and I'd have to look specifically at those maps as to why.
Just one other thought too. I think you have to understand that we still have a high number of COVID patients, right? Last March and April, we got down to 3. We're at 14, and we're still not accepting quite as many transfers. Now, that's gotten better, but I think we still have a lot of COVID patients. The second thing to remember is, you heard in the broadcast, we have 14. Hays has 11.
Yeah.
That's not an insignificant number, and there's some early indications that the things we're seeing in Colorado are seeping into eastern Colorado and then into early western Kansas. So we're not out of the woods here, and the reason is that whereas across the United States, 68% of Americans 12 and older are vaccinated, which is great. In our area, it's like 55%. Now, you could say, well, gosh, a lot of people may have had Delta, so they had some natural immunity. But natural immunity looks like it wanes after 6 months. And I think that the problem we face is that we still have a lot of unvaccinated people. We're going back inside. We're going to have masks off. And it feels like this is that game, where it's kind of like whack-a-mole. You whack-a-mole. And every time we take the masks off, we go inside, boom, here comes another surge, whack-a-mole. And I think we're going to play some more whack-a-mole this winter. That's my fear.
And I think to your point about Hays, and although they have 11 patients, we have 14, we have more. However, their overall population out there in the West is smaller, and so they have definitely more cases per 100,000 people per capita. And that could be some of the reason why, if you're looking at a heat map, the color would then tend to be darker. Kind of what
it's still darker. And I think the South, especially the deep Southeast, like Florida or deep Southwest down in Texas, had such an outbreak of the Delta variant. They may have some more natural immunity, but I think the real challenge to us is that as masks come off, people go indoors, winter's here. Adam, I think that's going to be a recipe for what we've seen in the past.
Yeah, I agree. Yeah.
Other questions? All right. So get your questions sent in. We're going to get to those here in just a few moments. But without further ado, we want you to meet these kiddos who are stepping forward this morning. Cannon, he is 10 years old. Hi, Cannon. Sunny, hi. She's 8. Dominic. Hi, he's 5. Full disclosure, the latter 2 are mine. And Cannon's mother is proudly waiting in the wings to watch Cannon get his vaccination. So these 3 are just moments away from getting it. It has been a long 20 months, as we know, for kids during this pandemic. We have watched kids, though, buck up, make things happen during what has certainly been a very confusing time for them. And now the time is here to help get life back to normal. So let's get to it. Nurse Kelly, I want to let you get started.
You ready?
And so while you're doing that, Adam, I do want to ask you a couple of questions. So Kelly's down here. She's a pediatric nurse. Why do we need a pediatric nurse to treat kids? A shot's a shot, right?
Well, so, we know kids are different. We want to have the experts that take care of kids give these doses. That's important to have our pediatric team that here at KU that's taking care of kids every day give these doses.
Doing it right. Okay,
That's
so tell
right.
us what is different about this dose, the vial itself, the needle, how is this packaged up differently for these kiddos?
Absolutely. So the dose is a smaller dose. It is packaged specifically by Pfizer BioNTech. Oh, we've got the first shot going in.
First shot going in.
Awesome.
That's it. Fantastic. Congrats, Cannon.
Man, Cannon,
Way to go,
Cannon
pal.
was awesome.
Hey, Ken, I got a question. Did you know there was going to be a needle?
All right, move the line on down.
There you
And
go.
Sonny, you're up next. Are you good? You need me over there? You got this. You got it. Thumbs up.
She's got it.
Brother's going to hold your
All right,
hand.
I'm gonna get everything.
So tell us again, Adam.
Yeah.
Okay.
So the Pfizer BioNTech manufacturers have packaged this differently.
Mm-hmm.
We don't draw these doses out of an adult vial. These are separate pediatric vials that were sent to us. They arrived yesterday afternoon. We were excited. We had teams literally dancing when the vials came in.
Adam,
so yes.
you text me.
Yes.
And you sent me a funny GIF, a silly little picture of somebody like dancing or doing
Ron Swanson from Parks and Rec dancing
I
around.
love Ron
Yes,
Swanson.
yes.
He's the best.
That's right.
So that's kind of how we roll
Yes.
during this pandemic.
Yeah.
We send
Yeah.
these funny
Yes.
like memes and gifs. It kind of gets us through the day.
Yeah.
But I was like, no way. I knew
Yes.
you guys were excited.
Yeah. So the team's been incredibly excited for this moment.
All right, Sonny, you ready, sister?
Okay, we'll let that dry. And then I want you just to let your arm relax. Yeah, just let it hang. Good job. Okay, ready? Go. 1, 2, 3.
Like a champ.
Well done. Sonny, now that you've been vaccinated, what do you want to go do?
Hey, Sonny, Dr. Stites asked you something.
What do you want to go do now that you're vaccinated?
What do you want, travel?
Las Vegas.
Go to Las Vegas.
Sonny, so here's your. Are you going to take your mom to Las Vegas, or are you going to take, say, Dominic to Las Vegas?
Nobody.
Nobody. Whoa. She's traveling wild.
I have
love
taught
it.
her well. I've taught her well.
I
Didn't
love
you used
it.
to work in Las Vegas?
I did,
Yeah,
yes.
yeah,
My
yeah.
children are Vegas babies. They were born there. But
it.
all right, pal, you got this.
You're gonna do so good.
All right, moms might have to take a picture of this.
Absolutely.
Can I just zip over there and do that?
yeah.
Okay. So, Adam, isn't it true that these doses are a little more stable at a little warmer temperature? Because they've made it a little differently.
Yeah. The stability is different than the adult doses, and our team has done all the preparation to keep the doses stable once the vial's been punctured.
Cold, okay?
Yeah. That's good news, huh?
Yeah.
Because we had that ultra freeze thing before, and now we don't have to do. What's it? What is it like a normal refrigerator this time?
Yeah,
That's
we get
cool.
to keep it in a normal medication fridge.
Okay.
Cool.
Do you want to hold your mom or your sister's hand? Okay.
Oh.
Sorry.
Do you want me to do that?
Thanks.
Absolutely.
All right. Now look
Ready?
at Adam. Look at Adam.
1,
Take 2 seconds. It's okay. No, don't pull here. I gotcha. It's okay. It's okay.
You got
Look
it,
at Adam.
okay?
Hey, look at Adam.
Hey, look it over here. Look it
We're gonna get a donut when we're done. It's okay. You got it. It doesn't hurt. It doesn't hurt. It
Can I
doesn't
bring
hurt.
another
Wanna get
nurse
donut?
out?
What's that?
Can I bring another nurse?
Yeah, of course.
I'm gonna bring Bailey out.
That's okay. So
This
we're
is
bringing.
the fun of peds. We like to have as much help as we
Okay,
can.
this is why you said you have pediatric
Okay,
nurses.
yes,
yeah,
Okay,
absolutely.
gotcha.
So Bailey's gonna help me hold your arm, okay? And can you scoot forward in your chair just a little bit? This way. Good job. Okay.
There you go.
And we're gonna count to 3, okay?
Okay. Hey, look at mom.
1,
Hey,
2,
hi. Donuts. Donuts for everybody.
Good
It's
job.
okay. How you feel? Good.
All done.
Hey, Dominic. Can I have a high five over here?
Okay. You did
Bring it
awesome.
in.
Right there, brother. Don't let me hang too long.
Love it.
Well done.
You know, I think this is extremely important because there's a new preprint article, and again, not peer-reviewed, but there was a commentary in Nature yesterday about it, showing that people who are vaccinated have a substantially lower risk of getting even an infection
Yes.
when those other non-pharmaceutical interventions are done as well. So we've always heard masks don't work, distancing doesn't work. This article shows, and the commentary talks about it, again, it's in Nature. Anybody
Which is like one
get
of the
it.
finest of all
It
the
is,
medical
yeah.
journals. Nature, New England Journal, that's like the two top
And they
ones.
show that your risk in those high risk exposures, so indoors, close proximity, masking does work, but even people that were fully vaccinated had even less of a reduce of getting infection as well. So it is a combination, and it is that Swiss cheese that we've talked about, those combination of factors. And really what we're looking to do is protect these children. We know that their risk of going to the hospital is lower, but they do have risk, and we know that they have risk of the multi-system inflammatory disorder. They have risk of long COVID. I mean, how heartbreaking would it be to see a child who has chronic fatigue and can't go out and play and do those things? We know that these vaccines will help protect against that. And now, again, with masking and doing those things in those high-risk situations, with vaccination, they're going to be even less susceptible to infection. So I
Yeah, and you
it's
think
very
about
important.
even when Dr. Myers was here earlier this week from Children's Mercy and was talking a little bit about the number of deaths they've had at Children's from this. It is not an insignificant thing. And I am just glad these three folks are now vaccinated and can go to Las Vegas. What do you want to go do?
Hi.
Yeah, what do you want to go do now that you've been vaccinated?
Florida.
Florida. Awesome.
All right.
Florida.
Beach.
Dominic, where do you want to go?
New York.
New York.
They're
We
leaving
got some
it-
travelers.
We do have some big
This is
travelers.
awesome.
travelers.
I
And
like
they're
it.
leaving all of us behind.
Yeah.
Yeah,
so
they are.
Even more fun. Okay, so Adam, they're going to sit here for
I'm
15.
in Alabama. I want to go to Alabama.
Alabama. All right.
Floribama.
Yeah, so they're going to sit here for 15 minutes, just
Florida.
like we do with
Yeah.
our adults, and watch them. We're going to have them back in 21 days to get their second shot.
What are you looking for during this 15 minutes? Same thing with adults?
Same thing with adults, and everything that we've seen in from the FDA and the CDC and the studies that have come out. Same sort of mild side effects: sore arms, maybe a little bit of fatigue, malaise in the evening, but same sort of things that we're looking for when we give adults their vaccines.
All right, so we're going to check back with you guys here in just a little bit. We're really proud of all of you, okay? Feeling good? Okay, we're going to get to some questions, and we're going to hang tight there for a second, okay? Cliff, did you say that we have a media question? Cody, are you on the line?
Hey, sorry. Yeah, I was just curious. You mentioned that the shots came in yesterday. When will they be widely available for kids at the health system?
Yeah, absolutely. So our pediatric clinics will start giving them today for kids that are able to get into one of our peds clinics. We also have some pediatric specific clinics coming up next weekend, Friday evening and Saturday morning. For just this age group, so parents can bring their kiddos in. But yeah, starting today, people will be able to call into our clinics and get an appointment scheduled, or if they already have an appointment scheduled, they'll be able to get their vaccine.
And for the bigger clinics next Friday night and Saturday, how do the people find out or sign up for that?
Absolutely. So through our MyChart app or through our health resource line.
And do you have to be a patient here?
So we are encouraging patients, but we're also accepting new patients as well. They will have to call our health resource line and get a chart opened. But parents who if we haven't seen their kids, they can absolutely call that number and get a chart and get in to get vaccinated.
What about flu shots? Can they get them at the same time?
Yes, so we will be offering flu shots as well. So if individuals would like to get their flu shot, we're going to work on making that happen in our pediatric clinics. Certainly in our pediatric clinics today, you can get your flu shot as well. You know, one of the things that I said the other night is we see this as a really great opportunity for parents to be talking with their primary care providers and their pediatricians. And if you don't have a primary care provider or a pediatrician, this is a great opportunity to get you and your family established with one here at the health system.
All right. Dr. Stites, I'm going to get to some questions from the community. Do you have any? You want me to roll on?
Let's go.
Let's roll on.
We're going to, well, we got a few more riffs coming. But
I know you do.
Yeah,
I know you do.
Yeah.
Wait till the end of the show.
Yeah.
That's right.
We got a special moment at the end
We
of the show.
We do. Okay. Isaac just wants to know the total number of patients active and recover, 33. How long has it been since it's been that low? You mentioned that.
Yeah,
earlier.
well, right. It's come and gone in ways, Hawkeye, and I think last in the spring was probably that. And even in early summer, June wasn't too bad, but then the spike started as things revved back up again. Mm-hmm. So it's been a while. And what's different? What's different is we had a mask mandate. We keep coming back to this. The numbers go up. We put masks on. They begin to moderate. We take the masks off. The numbers go back up again. That's the whack-a-mole game. What we long run will hope for is this combination of things as far as hospitalizations around COVID-19. First, vaccination. Second, a number of you have had it. And third, these new oral medicines are going to help prevent hospitalization. The new oral drugs will probably replace a lot of the infusion of the antibodies. We probably won't need to do that as much. So these new drugs will be much more accessible to folks. And I think that combination that's probably going to be something that, if it looks as good as Pfizer and Merck are saying they do, to Hawkeye's earlier point, we want to see the published data. But the study board, and it's a big deal for the Data Safety Monitoring Board to stop a study early. So that tells you that an independent group has looked at those results and said, this is such good information. We're done. Get the drug. Let's go. And so that combination, that's really exciting. I don't want to say we're back to normal once that happens, but man, if you have great vaccination and you have oral therapy and you can still get people to wear masks when they're in high-risk settings, we'll put an end to this. Mm-hmm. That will be the best.
Yeah. I think we always said, these vaccines are really not made to protect against infection. We know that they do, especially in the time period just after being fully vaccinated, especially that first 3 months. We've seen great data to support the fact that it helps even block infection. And we want to block infection because, or we want to protect against infection. We want to protect against severe disease because we don't want you to come to the hospital, have to go to the ICU. So if we are taking it out of that medical realm, we still have people who don't believe in the pandemic, but just look at the supply chain issues that are evident all over the place. Look at the economies that have been hit both here and abroad. Hopefully, with vaccination, continued non-pharmaceutical interventions, and these possible new oral pills, this will help get our economy back on track, start correcting some of these supply chain issues, and really get back to things closer to what they were in 2019 as compared to what they have.
That'd be so good. And, the other thing, 750,000 people have lost their lives in America to COVID-19, and that did not need to happen, right? That did not
And that's
need
probably
to
an
happen.
underestimate.
Yeah, it probably is an underestimate.
To your point about the pill, But Dean on YouTube says, won't that person who takes the pill have spent 3 days spreading the virus before getting treated versus someone who just got the vaccine?
Yeah, you bet. That's another important point, Dean, and thank you for making that, because that's another good reason to make sure you've been vaccinated, because you could have easily spread the virus, especially to people in your household. And again, there is nothing better than these vaccines. You know, Pfizer, Moderna, J&J, take your pick. They are all three amazing. If we had said earlier in this pandemic that, we're going to have vaccines that are going to have you between 77 and 95% effective, and they're going to last for at least 6 months, so you may have to get one booster, but it's going to do all these great things. It's going to eliminate hospitalization, severe hospitalization and death. We would have said, yeah, whatever. Sure.
And I think that's a great point, and good insight. And if we go back to even the beginning, when we first learned and really understood the real problem with this virus as compared to SARS-CoV-1 is that you have such great amount of spread prior to having any symptoms whatsoever. So that is a very good point, and that's why we say not everything is black and white. There are grades and graduations, and that's why we also need these other measures as well.
Okay, media is asking, Adam, if you know the hotline number that they need to call.
Yeah.
Do you have that off the top of your head?
I do.
Yeah. Shocker.
913-588-1227
Okay.
is our health resource line.
588. We're going to be like that NPR fundraiser.
That's right.
913-588-1227. Make sure you
Yes.
call 588-1227 to
Yep.
get that in.
That's
and
right.
just to say, you guys are pretty busy right now because you got influenza vaccine.
Yep.
Now we're doing kids, and we're doing booster shots.
That's
so are your days kind of full?
They are a little bit full, but this is really great. And we were talking about last night with my own family, heading into the holidays, making sure that people are boosted, making sure that we've got kids vaccinated. It's the right thing to do. People want to have some sense of normalcy around the holidays. So this is the right thing to do for the community.
Keep us safe, Kansas City. We can do it.
And guess what? If you're going to the Chiefs game, you can get your booster or your vaccination this Sunday. So the health system and Chiefs are putting on another vaccine clinic. It's going to be about 11 a.m. I'm just getting this. I'm reading this as it just came into me. About 11 to 3 at the Founders Club.
Yeah. So we'll have a team of nurses from the health system out at the Founders Club this Sunday from 11 to 3 giving vaccines. You'll have the option of getting first, second, or your booster dose. We do ask that individuals, if they're interested in doing that, bring their vaccine card with them. That's that important piece of documentation so that we know which shot we're giving you, and we can also document it and send you on your way.
Good stuff.
And it is kids it's 12 and over.
Yes, yeah. Right now we are only doing the vaccine 5 to 11 here at the health system in a clinic setting.
We don't have that many doses so far. We got our first shipments. We got a fair number. But
we did. We got 4,500 doses with our first shipment, and we're continuing to work with the state of Kansas on that rolling order to come in, so we make sure to take care of the peds patients that do want the vaccine.
So Stacy says, I'm pretty sure this is anti-vax rhetoric, but I keep hearing that kids don't need the vaccine per Pfizer's own data. The vaccine will do more harm than help. Is this true?
No,
She's worried about just hearing these things out there. It doesn't help parents.
Made up news network. Don't be a rumor reporter. No, it is absolutely not true. It's clear that vaccinations helped young children. I just remember listening to the data from Children's about how many deaths they've had already from COVID-19. I mean, that's, I don't know why people put that kind of stuff out there. What is so bad about getting vaccinated, especially when we've proven over and over again with billions of doses given across the world now how safe these vaccinations are? It's just amazing to me that people still want to cling to false information.
Why isn't natural immunity being considered as immunity?
Okay, well, once again, and Hawk, you take this one, then I'll follow up, please.
Yeah, I mean, again, we have continued good evidence to support the fact that if you were infected, especially if you just had mild disease, those people that are vaccinated or those people that had even infection and then vaccination had much higher antibody levels. Now, we know that immunity is just not antibody levels, but sometimes we use that as a proxy to adjust and identify immunity. But what we also have seen is that those that are vaccinated and fully vaccinated have a wider breadth of immune response to variants that are circulating as compared to what they were infected with. We also have good evidence now from Morbidity and Mortality Weekly Reports, the CDC publication, that those that are vaccinated have less chance of reinfection afterward. So we have good evidence to suggest that vaccination, even getting one dose, although it's not recommended, you still need 2 doses after infection, but even getting 1 dose of vaccine after infection helps reduce the risk of reinfection, as well as increase that breadth of immune response to other variants that are circulating, or more than likely other variants that will circulate in the future as well. And so natural immunity is not, it really just is not as good from what we have seen and from this basic science research. And so that is why we continue to promote the fact of vaccination versus natural immunity. And the fact is, Steve, as we have said, anytime you get infected, you are rolling the dice to get those complications, because even prior to vaccination, we saw that there were some people who got reinfected, although it was rare, who did well, but we also saw that there were people who got reinfected and did worse. And so I think that's the real issue, is anytime you get this infection right now, you're rolling the dice to get those complications.
I'm just saying, and we, people want to say natural immunity to make it feel better, because that's the natural thing. And so, well, here's the problem. And if you've been infected with COVID-19, you're less likely to get infected again. But the problem is that you don't know how long that immunity is going to last. You don't know what happens with the variant. You don't know if it really fully protects you against COVID long haul syndrome. And you don't know that it's going to protect you fully against death and severe hospitalization, as does vaccination. Furthermore, if you have underlying diseases like obesity, diabetes, hypertension, COPD, heart failure, I can name a bunch more, cancer, then that natural immunity offers even less protection. And so since that's so many older Americans, I would just say to you, why gamble? Why throw the dice and say, oh, natural immunity? Why not say, natural immunity, if I've had it, great. Vaccination makes my immune system amazingly strong against COVID-19. So don't wait, don't hesitate. Vaccination is safe. And again, you and I are going to show a little bit more about that later today on this program.
All right, let's check in with our kiddos real quick, just see how they're doing. Dominic, you're over there humming us a tune.
They're sounding good, yeah.
I do. Dominic, you hum beautifully.
Do you need to get the wiggles out? Do you need to jump up? Get it out? You got it. You can stand up, sis.
Push-ups, push-ups.
Get a wiggle out. All right. You guys feeling okay?
No.
Doing good? Stop it.
He just want to get out of school. He just wants to get out of school. No.
Oh, he just wants to. Oh, he says he's not feeling well because he
I
couldn't
also
get.
can't get to the...
I like your thinking, dude. I do. All right.
He's just thinking
You're at
Florida.
school right now.
He's thinking Florida and Alabama. That's what
Disney
he's thinking
World,
right
yeah.
there.
He's got it on the mind. He's
Florida,
got it on the brain.
yeah,
He's
Florida,
already.
sure.
Some water. You want a cracker?
Ooh.
Hey,
Nurse
Dominic.
Kelly.
Hey.
Again, why we have pediatric nurses. She knows how to speak their language and make them happy.
Dominic, I have a question for you. Hey, Dominic, can I ask you a question? If we go to Florida, Disney World or Harry Potter first? Where do you go first?
Disneyland. I mean Harry Potter.
Harry Potter, yeah, baby.
Thumb it out.
That's it.
Where do you want to go?
Harry Potter.
Harry Potter and neither one. Disney World.
Yeah.
Yeah.
There you go.
Okay.
I
like
think,
it.
yeah.
All right. Cool
Awesome.
beans.
All right, guys, we'll check in with you a little bit. We've got a few. Let's just get to a few more questions. What is? Hold on, I had a good one here. Hold on, give me a second. Oh, what do you think about this antidepressant pill? Did I ask you about that one? Curious about this antidepressant pill. We get that question a lot. Can we just address that one?
Yeah, I mean, I think, it was published in a Lancet journal, so that is, just as you said about Nature, Lancet is a very good journal, well respected. It was peer reviewed. I still have concerns about the data. Of note, we are with our therapeutics committee now, with Dr. Barr and Dr. Salate and Dr. Castro, are meeting to discuss about it. Now, it is an outpatient treatment, but some of the metrics they use to look at that are really a little bit different than what we use here in the United States. They were looking at being in the ER for over 6 hours or transferred to a tertiary care hospital rather than just hospitalization. If you look at one of the tables there, it says there was no difference in those people that got that drug for as opposed who didn't, for viral clearance, so getting rid of the virus quicker, for going to the hospital, for days off of the ventilator. So it's very difficult. So I think we're still waiting for more data. I think a lot of people around the world are pretty supportive of it. So we will see eventually what happens and what the final recommendations will be. I think there are still 2 larger studies that are still going on. So hopefully we will see more information from it. But our team here at the health system is meeting to see what we'll do with it. And again, it's more for an outpatient measure. And as we have stated, any of these outpatient therapies, whether it's monoclonal antibody or if we get these new drugs, these new pills, getting them sooner in the course of illness is always going to be better.
And again, that was addressing the anti-depressant pill to treat
Yes.
or help with COVID, and that was from Angela. So thanks for sending that in. Lindsay says, in order to know if I need a booster for Moderna vaccine, should I get an antibody test?
No.
No?
I think you don't really need the antibody test, and that's been pretty clear on the FDA recommendations. They've just said at 6 months you should go ahead and get a booster, especially if you're over 65, you have chronic underlying disease, or if you're in a high-risk category. I think when you sit back and you look at the Moderna data, it actually is still really good at 65. At 6 months out, there's a little bit of waning of immunity, but the real reason I think the FDA is saying let's go ahead and get folks that booster shot, Hawkeye, is not only does it protect you, but it may decrease viral transmission. Mm-hmm. And so I think they're really trying to make sure we've got another great safety measure in place.
Yeah, I think there was a new VA study, and the VA's been so good, number one, about vaccinating all of their patients. But also looking at the data about this. And I think there was a new VA study showing that the vaccines continue to protect at high rates and high efficacy against going to the hospital and severe disease and death. But we do know also in that peri-vaccination period of probably about 3 months, you have the highest chance of having reduced transmission or even getting infected as well. And so that is one of the other reasons why boosters here in the United States are being allowed.
And it's interesting, when you look at the hospitalization data, it is still about 80 to 85% of people hospitalized have not been vaccinated.
Yeah.
And much smaller percentage has been vaccinated. If you look at the vaccinated patients going to the hospital, it's really 2 disease populations. First is groups that are here and are asymptomatic, and they're coming to get some. They just had they had admission testing, so they came in for their hip surgery, and we still test and screen everybody, and they're positive. The second group is people with chronic underlying disease like diabetes, kidney failure, et cetera, that we mentioned, and they're coming in and they're positive. And I think that's the group who will be especially protected by this booster shot and will help with the waning immunity, because they didn't have some of those folks and some of those categories we now know don't have as great a response to even the first 2 shots, and really need that 3rd shot. So I think there's a lot of reasons we'll be smarter down the road. We've always said we're building the airplane while we fly it. We know a heck of a lot more about this airplane. It may even be coming a jet very soon. These new oral pills will probably turn it to a jet, but we're still building it.
Yeah, and I think to that point, it's very good. I think in that article, and again, this VA study I don't believe is published yet, but even in that article they did state something about since vaccination began, or fully vaccinated status began, really the people that were hospitalized or died, 90 to 94% or so of those people were unvaccinated since that time when you take all comers. So I think that is an important, very large number.
And I think we're seeing that in some of the other CDC data. We're seeing it in some of the international data, that if you've been vaccinated, your chance of ending up in the ICU or dying from this is really diminished by vaccination. And those folks who are vaccinated and still dying are, in general, people who are really high disease category, high-risk patients.
Last question, and Adam, help us with this one. Sayori is asking, is there a projection of how long it will take to vaccinate 5 to 11 age group in our area in relation to the supply availability? The earliest she can get her kid vaccinated is the 21st of December. Wondering if she should go outside of our area to get it, or just wait till the rush passes. Kind of what's this all going to look like?
Yeah, well, I think the last numbers that I saw, the state of Kansas has enough doses for every child that falls within that 5 to 11 age range. So we've got doses here within the state that the state has secured from the government in terms of Pfizer doses. Again, one of the things that I've been telling parents is be working with your primary care provider, be working with your local health departments. We want people to be utilizing their pediatricians or their primary care providers. I personally am not looking to go outside of the area. I think that there's going to be wide availability. You know, I got a message from my team that our schedules are already starting to fill up, which is a great thing, but I think we'll have plenty of availability to get people in here in the region and through their primary care providers.
And that number is?
913-588-1227.
All right, we're going to get
Yes.
to our final thoughts. And Adam, I am going to let you just let us know what you want us the big takeaway to be, and also will you just remind us about the vaccination events?
Yeah,
Chiefs
absolutely,
game.
absolutely. So, final thoughts for today, from my standpoint, I got a lot of questions actually this past week of what are you doing with your family? My wife is an educator, an innovation specialist in a school, and a librarian, and she got boosted. I work here in the health system. We made the decision to get boosted. We have a 5-year-old, and she's going to get the vaccine. We've talked with our pediatrician here at the health system. We feel like it's the right thing to do for our family. We felt like that conversation with our pediatrician was really impactful, and we think that this is the right thing to do for the community. So I would encourage parents to be talking with their primary care providers, to be talking with their pediatricians, and to get vaccinated. That's the biggest thing. Like Dr. Stites said, we know that the vaccines work. We know that they're safe, that they're highly effective. This helps our communities get back to that sense of normalcy. It helps protect our kids.
And people 12 and over can do that this Sunday,
Absolutely.
right? Out at
Yep.
Arrowhead?
This Sunday out at Arrowhead, we'll have that community vaccine event. Bring your vaccination card.
Simple.
Awesome.
Doc Hawk, your final thoughts today.
Yeah, I mean, let's stay on the vaccine train here. You know, we mentioned influenza vaccine for children. That is important. All of their childhood vaccines are important. So SARS-CoV-2, COVID-19 vaccine, influenza vaccine. Vitally important is HPV vaccine. If you have a child who is 9-year-old, please get them vaccinated against HPV. A large new study from the UK showing it cut cancer rates, for instance, things like cervical cancer, by 87%. And so it is so vitally important to protect your children from these things as they get older. If you have children that are 9 years or older, please get them in to be vaccinated against all of their preventive diseases, but also including HPV, which is not used widely, certainly not as widely as it should be.
Dr. Stites, we're going to get to your final thoughts and a little special treat for you this morning, but let's get to our kiddos.
How are you guys feeling? Good. Everybody feeling good? Ready to go to Harry Potter World? Are you guys taking me to Harry Potter World with you? No. I have to stay here.
Nor are you going to go to Las Vegas. Nor are you going to go to New York.
That's right.
I have a feeling Adam is super fun in Las
You're
Vegas.
staying here and working.
Sonny?
Yes, I've got it.
You're
I've
going
got
to Las
it.
Vegas.
You got to take her. You got to take her. Oh, she said you're going.
Oh, yeah.
I love it. Perfect.
Road trip.
You?
I'm left here. I'll hold down the fort. You guys
Yeah.
go have a ball. Okay.
Go, Sonny.
So your final thoughts today is coming in words or actions?
Mine is an action because I think we're going to talk about the booster. We've been talking about it all along. It's time to show it. Wait a minute. That
Take
means
it
I
off.
gotta
Let's
unbuckle
go.
this, baby. Here we go. Here we go. Here it comes.
All
I think
right.
I've got one. I think Hawkeye does Hawkeye get one too?
I got 2.
Awesome.
Are you
And
doing
you
it?
know what?
Do you want to, or you want to wait?
Why not?
All right. Okay.
Here's the cool
We're
part.
just-
Here's the cool part.
I'll take
people.
as many of those vaccines as I can get.
It's a Friday. Let's get it done.
Here
I
is
love
the cool
it.
part of getting this vaccine, and a pediatric nurse is going to give it to me, which is appropriate
Because
I'm
he's a big,
child
and you're a
at
big
heart.
baby. You're a
Hey,
big baby.
Wait a minute. I just I was a big baby. Some people say I have the man flu now and then.
All right, show the guns.
I'm going to show.
Show the guns.
Please.
Let's do it.
He has guns. I have a water pistol, okay? Here we go. Here we go. All right. I got a white T-shirt.
This is the
I
Moderna
know, we all have
booster
the white
that they're
t-shirts.
getting this morning.
Thank
So this is the Moderna booster that you guys are getting
50
this morning.
micrograms, right?
Yep,
As
this
opposed
is
to
the
100.
50
Who's going to
micrograms.
hold my hand?
Oh,
Sonny's going to come over and hold your
Hold his
hand.
hand.
All right, you guys want to count to 3 with me?
All right,
you
hold
count
on.
to 3 with me? You want? Okay. 1, 2, 3.
Yeah. Good job.
I got my band.
There you go.
I do
Make
get-
sure you
yeah.
move your arm around.
Do I get one?
Oh, yeah.
Do I get one?
Oh, wait
All right, Dom, you go hold
Dom,
on.
You
and
just
Andy.
wanted
Hold
to
his
take a
hand.
shirt off. I know what's going on there.
All right.
Okay.
Dana, did you make it to the gym this morning?
No.
No.
I've been
We
taking
can
a
tell.
break.
Wait,
I'm
wait,
getting
We can tell.
I'm getting old, so I have to give my joints a rest.
Okay.
Hold his hand. Go for it.
Is he
Can
gonna
I tell you
cry?
Okay,
something?
I'm gonna clean his arm real fast.
Okay.
Are you going to the other side?
Okay, you gotta
Yeah,
hold his
there you
arm real
go.
still, okay?
Hold it.
Can I say, Adam, you didn't ask me if I went to the
Will you
gym
guys
today.
help me
I-
count?
And Adam,
Okay,
I
let's
did
count
go to
to
the
You did
gym.
go to the gym. Well, at least one of us
I
made
did
it to the
lunge,
gym.
I did all sorts of work in the gym
three.
today.
Poke.
All right. That was awesome.
Awesome.
Nah, no blood.
Band-Aid.
No blood?
You don't get blood there.
Good
I
job.
was just poking him. Are you guys doing good?
Can I just say, you guys are awesome. Well done. Thanks to all these cool kids for being here.
I feel
and
like some future doctors and nurses in the room.
That
with
would be
us
the
here.
best?
Yes.
Yeah.
and I just want to say to all of Kansas City, don't hesitate. Make your date. Get boosted. Call 913-588-1227. If you need your vaccination, if your children need your vaccination, you need a booster, give us a call. We're here to help because you know what? We want to keep you safe.
Did you good? You did good. Did good. All right.
Yeah, wait till about 5 o'clock tonight.
I know. Okay, so everyone, thank you so much for being with us today. We appreciate it. And do not forget to send in pics of your kids celebrating getting their shots and happily becoming part of the vaccinated community. Coming up on Monday. This weekend, as we know, folks will be out getting their vaccines, we hope. On Monday, we're going to continue our look at kids getting them, and we're also going to be joined by members of the COVID Care Force. There they are, and also Heart to Heart International. We're going to talk about how they are assisting vulnerable communities, what areas need help, and how you can help too. And don't forget to catch these shows anytime on Facebook and YouTube and our podcasts. Have a great weekend. Stay safe. Get vaccinated. We'll see you back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.